Dear students, welcome back. We have finished the muscles which are present in the thoracic region. So here, now we are going to see the intercostal nerves. Before going to intercostal nerves, first we have to revise the typical thoracic spinal nerve. As we know that the spinal cord is made up of 31 segments, out of which 8 cervical, 12 thoracic, 5 lumbar, 5 sacral and 1 coccygeal. Isn't it? A pair of spinal nerves which is coming from each segment of the spinal cord is called as spinal segment. Isn't it? So in the case of cervical, thoracic, lumbar, and sacral, this a pair is coming from one dorsal root, one and ventral root, forming a mixed nerve, and which is coming out of through intervertebral foramen. After that, it is divided into dorsal rami and the ventral rami. Dorsal rami and the ventral rami. So this dorsal rami is also called as posterior. This ventral primary rami is also called as anterior primary rami. Isn't it? So up to this, every spinal nerve is exhibiting the same type of thing. In the case of cervical, all these ventral rami forms the plexus, and also in the lumbar as well as the sacral also forms plexus. But in the thoracic region, it doesn't form any plexus, and each nerve has a course for it, isn't it? So now we are going to see the typical thoracic spinal nerve. Typical thoracic spinal nerve. That means this typical thoracic spinal nerve only supplies to the thoracic region. It does not form or it does not join with any other nerves. Okay. Out of 12 thoracic spinal nerves, the upper 3 nerves forming some connections with that of the upper limb, and it is also supplying some part of upper limb, whereas from 7th, last 5 thoracic spinal nerves also supplying not only to the thoracic region, it is also supplying to the abdominal region. So the middle, from 4th, 5th and 6th, these 3 nerves are supplying only to the thoracic region. It does not give any branches to any other region. So they are called as typical thoracic spinal nerve. So now we will see the course of the typical spinal nerve. So after coming out of the intervertebral foramen, it divides into posterior rami, that is called dorsal rami, and the ventral rami, isn't it? So again, this ventral rami, it gives some muscular branches. It divides into 2 branches. One is the lateral branch and the anterior branch. Okay, so this will come anteriorly, anterior branch. This lateral branch goes on the lateral side. Again, this lateral branch divides into 2 branches, and one is the posterior branch and another one is the anterior branch. It supplies posterior as well as anterior branch. This anterior cutaneous nerve, again, once it comes anteriorly, it divides into 2 branches. One is the medial branch and the lateral branch. This is the course of a typical thoracic spinal nerve. The same kind of things are exhibited by the intercostal nerves. Intercostal nerves are nothing but the ventral rami of all these thoracic nerves, mainly from the intercostal nerves are mainly formed by the anterior primary rami of spinal nerves from T1 to T11. T1 to T11. Why? Because they are called as intercostal nerve. These nerves will have a course in the intercostal spaces, so they are called as intercostal nerves. We are having 11 intercostal spaces, so 11 intercostal nerves, and we are having T12 also, but the T12 is not considered as intercostal nerve, and this T12 nerve is called as subcostal nerve. So this is the course, the same type of course we are going to see in the intercostal nerves. So in the next video we are going to see the course of intercostal nerve and also its relations. Thank you.